This is Local 24 News Midday.
Welcome back to this Midday. A new FDA trial hopes to find less invasive techniques to help patients achieve their weight loss goals.
Dr. George Woodman is the chief of the Department of Bariatric Surgery at Baptist Memphis Hospital and the leader of the Center of Excellence. He's here now to talk to us about the best way for patients to achieve their weight loss goals. Thank you so much for being with us.
Thanks for having me.
And you just got out of surgery.
Yes.
So you ran over here. So first of all, though, we have this exciting FDA trial that we're a part of here. What exactly is this?
Well, this is a trial to try to find a technique, a procedure that we can less invasively help people to lose weight. Bariatric surgery is very common. Obesity is an epidemic, and so there's an unlimited amount of patients that we need to help. And surgery is a great way of helping, but it is invasive. And so we'd like to find a way that we can, maybe without incisions, get as good of results or close to as good of results. And so that's what this trial is about.
And how exactly are you guys doing that as far as the procedure? Exactly kind of walk us through how you work it. Okay,
well, just to give you something to compare to, the most common procedure in America is, around the world now, is the sleeve gastrectomy, where we take out about 75% of the stomach with surgery with incisions. With this FDA trial, there's an instrument that they can see on the screen now where we endoscopically go in through the mouth into the stomach without incisions and collapse the stomach so that it will hold less food. Wow. In addition, we put in some buttresses that can delay the emptying of food. So the goal is to help patients to be satisfied with less food and to feel satisfied for a longer period of time. And that's the ultimate goal.
How many hospitals are part of this trial?
I believe there's about 7 or 8 around the country that are participating in the trial. And we've had a lot of experience with trials here, from balloons to the lap band over the last 8 or 10 years. But this is about the 7th or 8th trial we've done, and it's exciting to be involved in it.
And you were saying that even though, these procedures work, obviously, it's up to the individual. They have to maintain a pretty good diet still.
Exactly. These procedures are designed to help someone to help themselves. And that's all we can do. And most people follow through on that, and this is an elective operation that most people don't need to have, but they, the fact is only about 3% of patients, once they become severely overweight, can't lose weight and keep it off without some type of help. And so we recognize that, and that's why surgery is looked upon so positively nowadays. So the fact is we can help people to help themselves, and they have to take it from there.
So there have to be lifestyle changes after surgery.
Absolutely. I heard on the radio last week a pill that you can take and not change anything about your lifestyle. You can keep eating the way that you want. That's not going to work. The only way to lose weight is to eat properly and to exercise.
Now, is that something that you guys try to preach to patients before you even do these procedures, to say, hey, why don't you try exercising and maybe eating a healthier diet before we even try this procedure?
Absolutely. And we do require that beforehand. We want to see patients making progress beforehand. Some insurance companies are making sure that patients are making progress beforehand before they'll approve the procedures. And I think that's, in general, an okay idea. But it is important to exercise and eat right, no matter what type of procedure you're going to have.
In this particular trial that you guys are doing right now, are you looking for people to get this done?
Yes. We're going to enroll about 75 patients in the study, and these patients generally have to be a lower weight, about a BMI of 30 to 40, and people can look that up on the internet. It's the same numbers everywhere, but that's about 50 to 100 pounds overweight.
Okay.
And they can't have any major comorbid conditions, severe heart disease and things like that, or have had previous weight loss surgery to participate. But if they call the number that they're given on the screen, we can tell them what the exact requirements are.
Okay, great. Thank you so much for being with us today. And how long do you think this trial will last?
We'll probably be enrolling for about 4 months. That's about how long it will take to find that many patients, and then we'll follow them for 2 years after that.
Yeah. Okay. Well, that certainly sounds interesting, no doubt. All right.
Thank you for being with us today. We appreciate it.
Thanks. Appreciate it.
We're back in a moment. Stick around.
All right.